Today we are going to demonstrate the method of collection of blood sample for culture. Since this is a microbiological method, you have to have strict aseptic precautions and to prevent the skin commensals and other contaminating flora coming into the blood culture. So now we are going to demonstrate how to collect the sample. So first of all, we'll put the tourniquet in. And tighten it and identify the site that we are going to collect the sample from. So once that site is identified only, you clean it. So you should not touch the site once you clean it. So when you clean the site of the skin for specimen collection, you should start from the site that you have planned and go outward, concentrically go outward. So you should not touch the center once you have done the periphery. Now we have used 70% alcohol and we wait until the 70% alcohol dries off. And now we are going to use betadine. You can see in the same manner, concentrically you start from the center and move toward the periphery, and you should not touch the cotton swab that touch the periphery with the center. And now you discard the cotton swabs, and now the next step is we are going to change the disposable gloves. Wash hands with soap and water. And next step is you are going to dry the hands and put on sterile gloves. So now we have left the site that we have cleaned with betadine for 2 minutes. So and we have changed the gloves during that time. So we have put on sterile gloves now, and now we are ready with a syringe. Since we need to collect about 5 to 10 ml of blood, you need a slightly larger syringe to collect the sample of blood. So now we are going to draw the blood from the site that we have identified carefully, and once it is drawn, we are going to take the syringe out and keep a cotton swab on the side of the collection of blood and take the tourniquet out. And we are going to put a plaster so that the site does not bleed. Okay. So what we have here are some of the collecting bottles that we put the blood sample into. So what we have here is the in-house prepared bottle of blood culture. So this is a universal culture bottle filled with brain heart infusion broth. So this is for the adult. So for this one you need to add at least 5 to 10 times dilution, which means 4 to 5 ml of blood from an adult patient, the adult blood culture bottle. So the commercial bottle is also there. So this is a commercially prepared bottle. So there are different types of bottles depending on the commercial products. So this is another bottle. So this is bacterial bottle, and you can see that this fluid is very black in color. That means it contains some charcoal which inhibit the activity of neutrophils and antibacterial activity. So this one also has some particles which bind to antibiotics. So the antibiotic action is prevented inside the bottle. And in the bottom you can see that there is a layer of brown color. So this is the chemical that will detect the growth of the bacteria. So when there is a growth of bacteria in this blood culture bottle, because of the chemical reaction, it will be detected by the machine, and the layer in the bottom is the one that will help in that action. So this bottle also has a similar layer in the bottom. So these chemicals help in the identification of the proper organism in blood. So when we collect a blood sample into the bottle, we have to be careful that we have the correct dilution, about 5 to 10 times, and for adult bottles, and for pediatric manual blood culture bottle is what we have here. So this is a smaller bottle. So this bottle you can add about 2 to 3 ml of blood from a pediatric patient. So commercially prepared bottles are also there with a different colored cap. So both of them will have a pink color cap for pediatric bottles, and it will say that it is for pediatric. So this one says Bactec Aerobic Plus, and for pediatric ones it states that it's Ped Plus. So likewise it will be mentioned in the bottle. So now we are going to demonstrate to you how a blood sample is inserted into the bottle. So before we insert into it, so we have to clean the top. So there is a plaster here. So you remove the plaster and clean the top with alcohol. And then you add the sample of blood that we have collected into the bottle. Okay. Now, first of all, now we should dispose of the needle. So this is the scoop technique for recapping the needle. And now we are going to remove the needle and put it in the sharp bin and keep the needle aside. Now you have to take the blood culture bottle and shake it gently so that the blood is mixed thoroughly. And this will prevent clotting.